Hi, everyone. Good morning. Thank you for tuning in for today's YouTube live event. I'm Alexandra, the brand product specialist for MDPen, and today I wanted to talk to you about microneedling the lips. Now, the 29th of this week is National Lipstick Day, and even though I feel like lipstick might not be as popular as maybe it was in the early 2000s, I think people care more about their lips than ever. And with lipstick perhaps not being as popular, we do still see a lot of lip gloss, lip tint, lip oils, everything on the market now. Not to mention injectable treatments for the lips have really picked up in the last, 20 years, 10 years, more and more in popularity. And since we are a microneedling company, and I know a lot of you out there are microneedling with our pen, I want to remind you that you can treat the lips when you're microneedling. Now, I know you're probably like, Alex, that sounds so painful. It's really not. So, as long as your face is numb with a great topical numbing cream for that half an hour, you can treat the lips as well. Now, for people that are prone to cold sores and things like this, they may not want to do this treatment. However, you can, of course, have your provider make sure that you are treated prophylactically so that that will not be an issue during the treatment. And feel free to use the comments, guys. Ask questions related to microneedling with MD Pen for the lips. I'm going to kind of review everything that might be on your mind as far as questions go. Now, when we think of the lips and microneedling, a lot of you may have used the Refine cartridge. This cartridge, of course, is painless, requires no numbing, but you're not building collagen with this cartridge. You're drawing up hydration, you're plumping, you're doing all these beautiful temporary things. So, yes, you can needle with the 12 needle Restore cartridge with MD Pen. And with the lips, there can be different concerns. A lot of times there's volume concerns. A lot of times people want plumping, but a lot of times the lips in general age just like the rest of our skin, and the lines on the lip can become thinner. They can become less plump. Also, the lines on top of the lip. And as we get older, unfortunately, some ways that people can assess youthfulness or age of a face is by looking at lips. So, again, lips are getting thinner. Also, you have the anatomy of the lips also changing. So, this philtrum column here between your nose and your upper lip, the philtrum column also gets longer as we age. So, this space here becomes longer between the top lip and the nose, the philtrum. So you'll see people doing these treatments called lift lips, and they're not treatments; they're actual surgeries. So it's a type of plastic surgery where you actually, the plastic surgeon, will cut here, and they're changing the length of this philtrum area to make it smaller, which again can give a more youthful appearance. It can also lift and plumpen the top lip. Now, a lot of people have lost the shape of their philtrum. So, this is another thing where people will go to seek filler to reshape the philtrum of the lips. Now, while you can't really reshape the philtrum with microneedling, there are things that you can definitely do. Again, you want to needle the upper lip here, restore that collagen. This area here is your Cupid's bow. This will also change sometimes with aging, with volume loss, things like this. So you can restore it. And when you're treating the lips, you can stamp and you can also trace. I like a stamping technique personally. For the lips, I will trace the upper lip, and that's up to you as a professional. I like to divide the upper lip into three quadrants. So one, two, three. I'm someone with a pretty well defined Cupid's bow and philtrum. If someone doesn't, or if you want them to, it can actually check and you can go all the way across when you trace. Otherwise, you can do those three quadrants again. Also, just stamping right on the Cupid's bow, which again is this part of the lip here. And then this part here is the philtrum. So, stamping there, making sure your patient is comfortable. This is going to help with the fine lines, volume loss. It's not going to necessarily give someone big, plump, juicy lips, but it is going to help with, again, those fine lines you will see there. Now, guys, do feel free to ask questions in the comments. Again, we are talking about techniques for microneedling the lips. I'm talking about the Restore cartridge. You're having them numb for half an hour. You're using this. I would use the pure hyaluronic acid. As your treatment glide while you are needling. This product is completely vegan. It is paraben free, gluten free. It is organic. As most of you know, HA is naturally occurring in our body. And even if someone technically ingested this product, they would not have to be worried. I would use it as the aftercare. And also during the treatment as the treatment glide. Now, with MDPen as well, we do make an SPF lip balm. This is going to be an SPF 30. Those of you professionals will see this advertised. I recommend purchasing it. It's a nice thing to just be able to give your clients, your patients, keep it at the front desk. People will grab it. If people are microneedling their lips, if they're doing treatments for their lips, make sure they're also taking care of their lips, the health of their lips. They need to be wearing SPF. Again, you're going to be using the HA while you're needling the lips. You're going to be stamping and focusing on, again, you're going to help with volume. You treat the column of the lips, the philtrum, and a lot of people want this vermilion border here lifted as well when they're having treatments done. So stamping along there can also help redefine and lift that vermilion border area. I do want to give you guys a shopping code today. It's going to be LIPS26, and you can go shopping at mdpen.co for our serums. Again, I really think the HA serum is going to be the most appropriate for kneading the lips. It's okay if you were to ingest this serum. It's not going to hurt you in any way. For those of you that want more information on treating the lips in general across the spectrum and things that we as providers can do to help the lips for our patients, I'm going to be doing a video on that tomorrow on LinkedIn, and that will be at noon Eastern time. And again, that will have even more information. But yes, don't forget that you can treat the lips. And even if someone is actively getting filler and doing other things for their lips, for that lip volume, again, you also want to think about lip health. And a lot of times, again, there are fine lines all around the lips. You can get so close to, even if you don't want to needle the actual lips, make sure when you're doing your passes down here, I mean, you are right under there. You can get so close. But yeah, I mean, if the lips are numb and the patient wants them treated, definitely stamp over the lips and do treat those areas, guys. Thank you so much for tuning in for today's video. Again, there will be more professional information on LinkedIn tomorrow regarding helping your patients achieve their goals. And again, the 29th is National Lipstick Day if you are someone that wears lipstick, but no matter what your lip tint will get your lips in a place where you want them. Have a great week, guys. Bye.